There's 3 outstanding unresolved cases, 2 which indicate overseas a link, and the other one is still over a month old. So that means there are no cases where we don't know where they've come from in the last 2 incubation periods in the last 28 days. That'd be correct?
Yes, I think if we get a similar result today and tomorrow, and we'll be following up with these public health units, of course, just to check what have further investigations shown. I think that's a very reassuring picture.
And if that maintains like that, then you'd be comfortable moving to level 2?
Well, it will certainly inform our advice. There'll be plenty of people speculating on what the advice might be. It will absolutely inform our advice. It continues the pattern. Even if we think about the advice to move from level 4 to level 3, we wanted to be very confident there wasn't undetected community transmission out there. We were quite confident then we had a very promising picture, and that has continued obviously through the level 3.
So we're still exactly where we want to be on terms of our path towards elimination then?
I agree, yes, where we would want to be.
Can you talk about the health principles underpinning level 2? People are obviously hoping to be a bit more social, maybe expand their bubbles even a bit more, but we still have those physical distancing limits of 1 metre under the current guidelines. Does that sort of mean, are we still really not, should people not expect to be able to handshake, hug and hongi until level 1? What are those health principles?
Yeah, so look, I have to start by saying, the Prime Minister's later today going to give some detail around this. The core health principles will be around maintaining everybody maintaining a sort of strong position around physical distancing, hand hygiene, yes, you're right, and the not going out and spreading an infection if you've got a respiratory infection, and getting tested early. The principle here is if you don't know someone, then be really rigorous around physical distancing. But if it's close friends and family, then you want to be careful, of course. But it's starting to return to normal. I think it won't be situation back as it will be when we eventually get to level 1. So I would imagine it'll still be elbow bumps and so on, and quick hugs, but it won't be, my sense is it won't be yet to be hongi, and although that will be up to individual iwi, I think, in terms of what they would like to do based on the guidance we provide. So I guess the key thing about Alert Level 2 is, because we have got many more people around, many more interactions with people we both know and don't know, without the controls that are there in Alert Levels 3 and 4, we just need to maintain real vigilance around the physical distancing, and particularly in situations where it's not quite as controlled. A work environment or a school environment can be quite controlled. We know that people who are in different situations in classrooms or workplaces, but it's when it's the public transport and those sorts of places where people just need to be really, really vigilant and thoughtful.
And you're still in the same position in terms of mass masking?
I was having a conversation with the Chief Science Advisor this morning on this. Again, it's one of those ones where there's such a range of views. We've just actually had another look at the evidence. So one of the team here did a re-review of the evidence. There are benefits and risks. I think where we're settling, and we'll maybe talk about this a bit later on, but is that people may wish to use a mask. And if they know how to use it properly, then that's fine. But at this point, we won't be insisting on masking. And that's our interpretation of the evidence. And I think a key thing, of course, is when you see masks used as they are routinely in many Southeast Asian countries, that's a common thing where people are going out because they have a cold and they don't want to spread germs. And I guess the key principle for, one of our key public health principles is don't go out if you've got a cold, don't go to work, don't send the children to school if they have got a respiratory infection.
I just want to touch on the contact tracing, and you had a meeting with Dr. Ashley Bloomfield about how you're going in terms of implementing the recommendations in the report. Can you give us an update on that? And where are we with those 17 key performance indicators. Are we hitting those yet?
Yeah. So very quickly, I got a good letter from Dr. Verrill. She, broadly speaking, was very comfortable with progress, and I'll be just publishing her letter tomorrow that she provided to me last Saturday. And the key, I guess, I can't speak for the 17, but I think the one we all agree on, and that is a really primary indicator, is that time to getting a lab result, to identifying and isolating a contact, and the benchmark there is over 80% within 2 days, and we're hitting that now. So the data we put on our website yesterday for that 2-week period, 13 to 27 April, shows just over 80%, and that was around 275 contacts over that 2-week period. So I think that's very promising. Actually, there's some discussion around the indicator set she provided, and we've had other advice, and one of the reasons she came back in was to look at that other advice. So we will be tweaking it because we think there are some indicators that may be better and others that we aren't quite such an important emphasis. But that critical one, I'm pleased to say, for me, that's the gold standard one, and that's why I think we have reached where